Maybe your socks leave deeper marks by evening, a favorite chair feels easier to breathe in than the bed, or a short walk suddenly takes more concentration to keep a conversation going. Subtle shifts like these can quietly signal that your heart is working harder than it should. Today we'll unpack 9 signs to watch after 50 and simple, safe steps you can take next. Everything is explained in plain language and grounded in real clinical practice. This video is educational and does not replace your own healthcare team. Let's start with breathlessness during routine tasks. If a hallway you walk every day now asks for a pause, or making the bed leaves you unusually winded, that change matters. When the heart can't keep up with what the muscles and lungs are asking, everyday oxygen delivery falls behind and breathing feels less automatic. A quick way to sense it: the conversation test. Walk at your usual pace and try speaking a full sentence out loud. If you need to break mid-sentence just to get air, jot it down. Note when it starts, right away versus a few minutes in, what triggers it, inclines, carrying bags, and how long it takes to feel normal again. The mistake many people make is to blame it purely on age or fitness. Age and conditioning do matter, but a sudden or progressive change deserves attention. Keep that thought in mind, because the body often whispers in patterns, not in one-off moments. When breathing comfort depends on how you lie down, pay close attention. If sleep is easier propped up on extra pillows or in a recliner, that's your body telling you something. Lying flat redistributes fluid toward the chest. A strong heart adapts with ease, while a struggling pump lets fluid linger where it shouldn't. Waking suddenly, needing to sit on the edge of the bed to catch your breath, and settling over several minutes is another version of this story. Track your pillow count and any nighttime awakenings. If you're consistently better upright than flat, that's a pattern worth sharing. The common misstep is to chalk it up only to reflux or a late meal. Those can contribute, but they don't explain the full picture when other signs are present. Bridge that insight to the next clue, what you can actually see. Visible swelling that deepens by day is the third red flag. Look for sock imprints that linger, shiny skin around the ankles, shoes that feel snug by afternoon, or a belt notch that mysteriously loosens at night. A simple check: press your thumb gently on the shin for a few seconds. If it leaves a small dent that slowly fades, that's pitting edema, a sign of extra fluid. This often shows up together with breathlessness or night symptoms. Heat, salt, or standing long hours can all swell ankles, so context matters. What tips the scale is newness, progression, or pairing with other signs on this list. Many people treat leg swelling as inevitable with age. It isn't. Map it across a week, morning versus evening, desk days versus active days, and you'll see whether it's drifting in the wrong direction. A fourth sign is sudden weight gain over a day or a few days. 2 to 3 pounds overnight or 5 pounds within a week is not about fat, it's fluid. That's why morning weigh-ins, done the same way each day, after using the bathroom, before breakfast, same scale, minimal clothing, are so valuable. Write the number down and draw a little arrow up or down. The trend is more important than any single point. If the scale jumps and your shoes feel tight or you're adding pillows at night, treat that combination as a call to action. The common mistake is to ignore the scale because the mirror looks the same. Fluid can hide in ankles, belly, and lungs without changing how your clothes fall. Early recognition makes the safest difference. Small adjustments beat big emergencies. A dry, persistent cough or a faint wheeze that shows up at night can be the fifth clue. Not every cough is lung-related. When fluid irritates the airways, it can create a nagging, not quite asthma sound that's worse when you lie down. Many people treat this as allergies for months. A useful home observation is timing. Does the cough flare after dinner, as soon as you recline, or in the middle of the night? Do a few sips of water and sitting upright settle it? Pair this with the other signs. If you notice cough plus weight jumps or ankle swelling, elevate the question. If you use inhalers for an older lung condition, log whether this cough behaves differently. That contrast helps your clinician sharpen the plan. Next comes fatigue that quietly shrinks your walking radius. Maybe your favorite loop around the block used to take 15 easy minutes and now takes 20 with a rest, even though you haven't changed your route. Muscles are excellent truth tellers. When they don't receive enough oxygen-rich blood, they complain with heavy, rubbery effort. A practical baseline you can set at home is a 6-minute walk. Choose a flat hallway or a safe sidewalk. Start a timer and walk at a pace you could keep up for 15 minutes if you had to. Count steps, driveways, or lampposts. Log how far you get in 6 minutes today and how you feel at minute 2 and minute 6. Repeat once a week. The goal is not competition, it's pattern recognition. A shrinking distance over weeks is useful evidence that something upstream, in this case the pump, may need help. The common mistake is to normalize this slow drift as just getting older. Irregular or racing beats, palpitations, are the 7th sign that deserves respect. Quick flutters that last a second or two can be benign, but a heartbeat that turns chaotic or too fast for a minute at a time can make a struggling heart struggle more. You can do a simple, no-gadget check. Sit quietly, place 2 fingers on your wrist or the side of your neck, and feel your pulse for a full 60 seconds. A normal rhythm is steady, like a metronome. If the rhythm feels erratic with no pattern at all, write down when it happened, how long it lasted, and what you were doing right before: coffee, alcohol, stress, or lying down. If you feel faint, short of breath, or chest discomfort along with it, treat that as urgent. The common mistake is to dismiss palpitations because they go away on their own. Intermittent problems are still problems if they repeat and cluster with other signs. Frequent nighttime trips to the bathroom can be the 8th clue. It sounds odd, but as you lie down, daytime leg fluid redistributes and the kidneys catch up, turning extra fluid into urine. One awakening here and there is universal. A new pattern of 2, 3, or more trips every night, especially paired with swelling or weight jumps, can hint at fluid overload. Keep a simple 1-week log: what time you stopped drinking fluids in the evening, what you ate for dinner, especially salty foods, how many awakenings you have, and whether you feel swollen the next morning. It's important to say this symptom isn't specific. Prostate, bladder, medications, and blood sugar can all influence it, but in the presence of other signals, it adds clarity. The fix is not to dehydrate yourself, it's to understand the pattern and address the cause. Finally, appetite that fades, early fullness after only a few bites, or an expanding waistline, despite eating less, can be the 9th sign. When the venous system is congested, the liver and intestines can swell slightly, slowing digestion, dulling appetite, and making small meals feel like big ones. People often respond by dieting harder, which can backfire if the underlying issue is fluid and congestion rather than calories. Notice when you feel full, right away, halfway through, only at night. Track belt notch changes and whether on puffy days you also feel less hungry. If this pattern persists, it can lead to unintentional weight loss and low energy. The mistake here is to see a smaller appetite as automatically healthy. Context is everything. Now, how do you turn observations into action without panic? Start with measure and note. Each morning, weigh yourself under the same conditions and glance at your ankles. Jot your pillow count and whether you woke short of breath. On 2 days this week, do the conversation test during a walk and take a 60-second pulse check while seated. For anything unusual, write down the what, when, how long, and what you were doing right before. These notes are gold. They turn vague feelings into concrete information your clinician can use. Next, pick one safe habit you can start tonight. Reduce obvious added salt at dinner. Taste first before salting, swap salty sauces for herbs and citrus, and choose fresh over packaged when possible. If you're steady on your feet, try a gentle 10 to 15-minute walk after the last meal. It can help circulation and digestion. If your ankles swell by evening, elevate your legs for 20 minutes before bed. These small choices compound fast. Many people notice steadier breathing the next morning and fewer awakenings at night when evening salt and late-night snacking come down. Third, set clear thresholds for when to call. If your weight jumps more than 2 or 3 pounds overnight, or 5 pounds within a week, if you need more pillows than usual, or if breathlessness interrupts normal tasks that were easy a month ago, it's time to check in. Bring a one-page summary, 7 days of morning weights, pillow count, night awakenings, conversation test notes, leg swelling observations, and any pulse irregularities with their timing. One page, easy to scan. You'll be surprised how quickly your team can move when the picture is that clear. A few practical bridges can help you tune in even more. Starting with what's visible, make the mirror your ally. Ankles, sock marks, belt notches, and facial puffiness in the morning. Moving to what you feel day to day. Breath, cough, energy, and how far you comfortably walk before you want to slow down. When nothing is obvious in the mirror yet, the body still complains. Check the pulse and the scale. They often speak before symptoms get loud. If anything here sounds like someone you love, remember that noticing early is an act of care, not a verdict. These signs invite a conversation, not a conclusion. Let's knit the 9 clues together, quickly. Breathlessness during ordinary efforts. Needing extra pillows or waking gasping. Swelling at the ankles, legs, or belly. Sudden weight jumps across a few mornings. A dry, stubborn night cough or wheeze. Fatigue that shortens your comfortable walking distance. Irregular or racing beats. Frequent nighttime bathroom trips. Appetite fading, early fullness, or belly bloating. Spotting these early, side by side, is far more powerful than worrying about any one sign in isolation. Before we wrap, here's a calm, human anchor. Your heart is remarkably adaptable. It responds to honest information, consistent habits, and timely help. You don't need to overhaul your life in a weekend. You need to listen for patterns and act on them. Many people find that once they start tracking, what felt scary becomes a plan, one that buys back comfort, confidence, and more active time with the people they love. If this helped you, tell me which sign surprised you most. Share this with someone 50+, and subscribe so you don't miss the next 2 videos. Everyday salt traps after 50 and how to check your pulse at home without gadgets. Information guides decisions. Don't start or stop medicines on your own. Talk to your doctor.